was born in Ayutla, Jalisco, Mexico. We moved to San Francisco when I was about 2 years old. I was in San Francisco till I was about 12 years old, and then we moved to Turlock, which was what introduced me to the Central Valley. One of the big things for me, though, all throughout this time until I was about 19 or 20, I was undocumented. So that was a big thing that affected me growing up. I would say junior year, senior year of high school is when I started to realize the effects of being an undocumented person. Everyone was getting their licenses and applying to four-year schools, and I wasn't doing any of that. I knew I couldn't afford it, so I knew I was going to go straight to a junior college. So there was a lot of things that I was like missing out on. I was one of those few that I always knew I wanted to be a doctor just because it just grabbed my interest. I liked school, I liked learning, but I didn't know how to get there, especially in our Hispanic households. Girls typically and guys most of the time won't leave until they're getting married, and here I was, 20, 21, leaving home. But my parents were like, you do that, that's what you want to do, we'll do. My dad has moved me all throughout California. He has been there, we drive together. There's always people willing to help. So I scribed after college for a year, and I met a couple physicians during my job as a scribe that kind of helped me get towards the path for medical school. But it was hard. It was hard. You're leading the way. You don't know anything. You don't know how to study. You're just kind of learning as you go. I don't know how many times I'd go to family events and I would be told when are you going to get married? ¿Cuándo te vas a casar? All of the time. It's something you hear. So I feel like our young Hispanic women and our young Hispanic girls, they feel that pressure to not be able to do careers that take 10 years or more because you have that pressure from other people telling you, wanting you to get married and have kids and things like that. So I think seeing people that have done it or that are doing it or going through the process is really important. I truly love my clinic where it's at. It's in Parlier, California. We work with a lot of the farm workers, the agricultural workers. We have a lot of people that just got here from Mexico or other countries in Central America, and a lot of young people too. They're 12, 13, and they're learning a new language. So me being able to tell them and talk to them and tell them hey, I've used myself as an example for the young kids all of the time. You can do that. You can go on to further education, especially when sometimes you get a 3-4-year-old that says they want to be a doctor. And so I'm yes, at 3-4, yes, you can do it. So being able to not only communicate with them in their language, but also giving them examples of how things can be done. Sometimes, patients, yes, there is the best medication, but some patients can't afford that. So we have to go around them. We have to work with what they have when they can't have insurance because they themselves are undocumented. That makes things really hard. So learning to work with doctors that know how to work with that is really helpful as well. When we have kids, our kids are gonna know all of the things. So I want them to speak Spanish. I want them to see the pueblos, right? Not just Cancun and Cabo, but I want them to see Ayutla and what real life is like there. I want them to grow up with the foods that we eat. My mom and my dad both cook delicious Mexican food. So I want them to be exposed to all of that. But more than anything, I want them to speak the language. I want to teach them to be able to, so that they're fluent. My parents are always échale ganas. It's just go do it, go try, give it your all.